What are the symptoms of long-term radon exposure? Have you ever thought about the air you breathe in your home? Today, we are going to be discussing the symptoms associated with long-term exposure to radon, a naturally occurring radioactive gas. This gas can accumulate indoors and pose serious health risks over time. Radon is unique because it is odorless, tasteless, and invisible. This means you cannot detect its presence through immediate physical sensations. There are no noticeable symptoms from breathing in radon gas right away. Instead, the health effects develop slowly and typically appear years after prolonged exposure. The main health concern from long-term radon exposure is lung cancer. Radon gas damages lung tissue at the cellular level, increasing the risk of lung cancer. This risk is especially high for smokers, but even non-smokers can develop radon-induced lung cancer. The time between exposure and the onset of lung cancer symptoms usually ranges from 5 to 25 years. So what should you look out for? Early symptoms of lung cancer caused by radon exposure may include a persistent cough that does not go away. You might also experience shortness of breath or wheezing. Chest pain or tightness, especially when coughing or laughing, can also be a sign. Other symptoms include hoarseness, coughing up blood, trouble swallowing, and frequent respiratory infections like bronchitis or pneumonia. As the disease progresses, additional symptoms may develop. These can include unexplained weight loss, loss of appetite, and fatigue. There are other respiratory conditions that have been linked to radon exposure in some studies. These include pulmonary fibrosis, emphysema, or chronic interstitial pneumonia. Symptoms like increased coughing or difficulty breathing from these conditions may occur, but radon itself is not a direct cause of these symptoms. Because symptoms from radon exposure are not immediate and can overlap with other lung diseases, testing your home for radon levels is essential. If high radon levels are found, mitigation steps can significantly reduce exposure and lower the risk of developing lung cancer. To summarize, long-term radon exposure symptoms are primarily related to lung cancer, which manifests with respiratory symptoms like persistent cough, chest pain, and breathing difficulties after many years. Testing and reducing radon levels indoors are key to protecting your health. If you experience any of these symptoms and suspect radon exposure, consulting a healthcare professional promptly is a wise choice.